Teens come to our program Monday through Friday from 8:30 to 2 and receive intensive but short-term psychiatric treatment.
We realized that the work has the same level of success as the in-person teams, so we decided to expand and reach out to other states and say, hey, how can we support your states and teenagers and provide the same partial level of care for those teens.
The Reach Partial Hospitalization Program is a great option for families who maybe their teen is struggling a little bit in outpatient, not receiving enough support there, and can be a step up for those children. It could also be a great option for teens who are currently hospitalized inpatient and need a little bit more support stepping down into the community.
The teens also have individual therapy, so they'll meet with that individual therapist, and so we help them set an intentional goal for that as well. And they also have family therapy, and in a lot of cases that's where the tough aspect of treatment comes in, when they actually have to communicate with people that they live in a house with and talk about those tough topics. Team is completely virtual, and so that requires setting up the meetings in the morning and making sure that everyone on the team receives that Zoom link along with the patients as well, and then inviting them into the program, checking in with them regularly, every morning helping them set a goal.
As a clinical psychologist on the team, I provide individual, group, and family therapy, and I also collaborate with outside providers and schools to help kids transition to and from our program.
I'm responsible for family therapy. We do 2 family therapy sessions a week. The family therapist is really the liaison between the families and the rest of the programs. Obviously, we want families involved in their teens' care, and we believe that they're really important in the healing process.
We found through collecting data at admission and discharge from teens, families, and our clinicians that there are actually no significant differences between improvement over the course of treatment in our in-person partial programs and our virtual partial programs, which means they're basically equally effective. And in addition, we've noticed in the virtual program compared to the in-person program that there are fewer absences, meaning our teens are getting a higher dose of treatment. And we also notice significant benefit for families who typically would have barriers to access an in-person partial.
I think one of the strengths of our program is that we almost always have a transition meeting before teens are discharged from our program, which involves staff from school, staff from our program, usually the family therapist, the teen, and the teen's family. And virtually we do it via Zoom, of course. But we all get together and talk about what supports are available at school, which accommodations are available, and how we can make the transition back to school as successful as possible.
If the child does not have any outpatient providers, that's something we always make sure is secure before the child leaves, so there really is no gap in any of the therapeutic care that they've received.
Just a great group of people. I love working with the teenagers and seeing them actually make progress. It's exciting to watch teens be a little resistant and unsure and uncertain about whether they want to do the program, and then when it's time to leave, they then get apprehensive about leaving because they just enjoy the support that they're getting from all of the team members.
I love working with the families and the teens, and I feel very honored that they trust us to help them in difficult times.
It's very fruitful when you see a patient come in and they're very, mild and meek or focused on their anxiety, and as time progresses, when they come out of that shell, that's the most rewarding part of the job.
We all bring a really unique and genuine approach to our team, and I just love that we all have different perspectives and are able to collaborate in that sort of way.